Really nice to be here with you all, and thank you so much for having me here with BH Echo. We're going to go over a lot of content today, but feel free to ask any questions, or if there's anything you want me to talk about in more detail, I'm more than happy to do so. I've worked a lot with the American Psychiatric Association, primarily on their Committee of Climate Change and Mental Health, their advisory work group to the Board of Trustees regarding sustainable annual meeting reform. I work with the Climate Change and Mental Health Caucus as well for the American Psychiatric Association, with Hawaii's own Dr. Anthony Guerrero. I worked on a chapter for climate change and youth mental health through Cambridge University Press, as well as some other research articles. I'm a contributor to the Climate Psychiatry Alliance and formerly was a part of the University of Hawaii's Child and Adolescent Psychiatry Fellowship. This presentation, at times, especially the first third, can be a bit of a bummer. And for that, I'm sorry. I do want to focus on some critical milestones and projections for the Earth's climate, look at some of the ways directly and indirectly that our climate can lead to changes in things like trauma symptoms, depression, suicide, anxiety, and substance use disorders. And then I want to tie this back to experiences we may have with patients or people in our own lives. But I want to start discussing the components of climate change before getting into some of the evidence and then some of the consequences. First, let's talk story. In the 1950s, a young geochemist named Charles Keeling was trying to study the relative abundance of carbon dioxide in air and water. Up until this point, nobody had really measured atmospheric carbon dioxide with much precision. Keeling developed his own instrument and took samples in California, the Pacific Northwest, and Arizona. What he found was the same 310 parts per million. That is, for every million molecules of gas in the atmosphere, 310 of them were carbon dioxide. His work attracted the attention of the Scripps Institute of Oceanography, who approached him with a plan to measure carbon dioxide from several locations around the world, an ambitious plan to measure once a decade. But Keeling was a particular guy, and he insisted on taking measurements not once a decade, but once a day. See, the US Weather Bureau had recently built its observation station in the pristine air atop the Mauna Loa volcano in Hawaii, and its director proposed it as the perfect location for Keeling's work. They began tracking daily carbon dioxide levels, establishing the so-called Keeling curve. What he saw amazed him. To his surprise, the level of carbon dioxide in the atmosphere fluctuated throughout the year. During the spring and summer in the northern hemisphere, the swell of green landmass drew carbon out of the air. In the winter, some of this was released. For the first time, we had recorded our one and only planet breathing. The observatory at Mauna Loa has continued this tracking throughout the modern day. Earlier scientists had speculated that burning fossil fuels like coal, which contain the carbon from ancient plants, might increase carbon dioxide levels and cause global temperatures to increase, but their work was largely hypothetical. For the first time, we could see our planet's atmosphere filling with excess carbon dioxide. When researchers and policymakers say climate change, we're talking about both global warming driven by human emissions of greenhouse gas and the resulting large-scale shifts in weather patterns. That human activity has caused climate change is not disputed by any scientific body of national or international standing. The following is a non-comprehensive list of internationally recognized scientific organizations who've affirmed that climate change is real and is a result of human activity. Standouts here include NASA, the Micronesia Climate Change Alliance, U.S. National Academy of Science, American Medical Association, the American and World Psychiatric Association, and like so many more. The largest driver has been the emission of greenhouse gases, of which 90% are carbon dioxide and methane. Fossil fuel burning for energy consumption is the main source of these emissions, but we also have contributions from agriculture, industrial processes, and deforestation. Let's quickly talk about the greenhouse gas effect. Temperature rise is accelerated or tempered by climate feedback, such as the loss of sunlight reflecting snow and ice cover, increased water vapor, itself a greenhouse gas, and changes to land and ocean carbon sinks. Like the glass in a greenhouse trapping heat, we see an increase in temperatures on average across the globe. But land heats faster than oceans, leading to expanding deserts, heat waves, and wildfires. Arctic warming melts the permafrost, leading to the retreat of glaciers and sea ice. This map is supremely deceiving, however. Because of water's powerful ability to store heat, the ocean has actually absorbed 90% of the extra heat from global warming. Over the past 150 years of industrial revolution, the oceans have Hiroshima-class nuclear explosion worth of energy every second. Increased atmospheric energy and rates of evaporation cause more intense storms and weather extremes, which damage infrastructure and agriculture. These extremes are part of a larger pattern of climate change, destabilization of local and global weather systems. We'll cover this more shortly, but will suffice for now to say that the current frequency and intensity of extreme weather is unprecedented in global history. Earth's had a lot of changes before, so surely, some say, what we're experiencing now is nothing new. Human civilization benefited tremendously from this 10,000-year period of warm, wet, climatically stable weather we call the Holocene. But increasing human contributions to climate change ended the Holocene sometime around the Industrial Revolution. We humans are now stumbling blind through a new epoch, the Anthropocene, our epoch. During the time since 1880s, we've seen a fundamental shift in the range of possible temperatures. The average global temperature started increasing after the Industrial Revolution and has continued a meteoric rise since then. Put another way, and to say nothing of forecasts, the current spike in temperature related to human activity is beyond alarming. One last visualization of temperature here, which references the Ice Age Earth 20,000 years ago. The same change that occurred between 20,000 years ago and modernity is about to be repeated over a blisteringly fast timeline. Current forecasts from the International Panel on Climate Change, based on modern rates of pollution, place us just 80 years away from replicating a temperature surge strong enough to previously melt a half-mile thick sheet of ice, a change which previously occurred over 800 human generations. Global warming and climate change are associated with increased risk for global emergencies of nearly every kind. Since the 1980s, research has been published linking disasters to mental and physical health problems. Emergencies' impacts on mental health can occur after or even before a major disaster. The frequency of highly damaging, highly expensive disasters is increasing around the world. The 2024 season hosted a staggering 27 billion-dollar weather disasters, a record number which overtakes the previous all-time record for most mega disasters set in 2023. Climate change increases extreme heat events, including heat waves and droughts, due to decreases in ground humidity and higher levels of evaporation. Rising ocean surface temperatures and abnormalities in humidity are associated with climate change-related weather disasters, including sea level rise, flooding, hurricanes, and coastal storms. We also expect to see a rise in severe convective available potential energy thunderstorms, a particularly nasty category of weather events, including tornadoes and supercells. We're seeing more wildfires, yes, but on the other end of the spectrum, even winter storms and extreme snowfall can occur. And it might seem like a paradox for global warming phenomena to increase the prevalence of extreme cold and snowfall events. But it's important to remember that the climate crisis is as much about destabilization of existing weather patterns as anything else. Changes in global weather systems and jet streams bring foreign weather systems into our global regions. What's increasing isn't just temperature, but entropy. And I know what you're wondering. We're 10 minutes in. We haven't talked about mental health. And starting now, I promise we'll focus in. But the apparently controversial nature of climate science today necessitates establishing the facts before we dig into the gray matter. The World Health Organization forecasts 250,000 additional deaths annually starting in nearby 2030, mostly things like undernutrition, heat stress, and disease. They also project direct healthcare costs $2 to $4 trillion annually by 2030. And for their part, the United Nations calculates that for each year since 2008, an average of more than 20 million people are already forced to move because of weather-related events. For the first time, the World Economic Forum's long-term risk outlook is dominated by climate change in its many forms. At this moment, up to 80% of the global population is affected by some degree of water or food insecurity due to the climate change effects. This is according to analysis by the not-for-profit Climate Council of Australia. According to the United Nations and World Wildlife Fund, 1.1 billion people currently lack access to water, and 2.5 billion find water scarce at least 1 month of the year already. Many of the water systems humans depend on for basic survival have been stressed and are increasingly drying up or becoming polluted as a result of human activity. This is a crisis which is getting worse, not better. I'll let the World Health Organization Director General put it plainly. The evidence is overwhelming. Climate change endangers human health. Solutions exist, and we need to act decisively to change this trajectory. Put another way, climate change is the greatest threat to global health in the 21st century. The American Psychiatric Association recognizes that climate change poses a threat to public health, including mental health, and that those with mental health disorders are disproportionately impacted by the consequences of climate change. APA polling also found 63% of Americans believe climate change is affecting our physical health, and 48% of Americans believe their mental health was already impacted by climate change. Studies following Hurricanes Rita and Katrina found heightened cigarette and alcohol use among teens and adult survivors. Rates of domestic and intimate partner violence following displacement in the wake of Hurricane Katrina exploded to 3 times national rates. We see the same thing in 1992's Hurricane Andrew in America, or Hurricane Mitch in Nicaragua and Honduras, or the 2000 cyclone in Bangladesh. Take a moment to consider how traumatic it would be to live through a disaster like this. How do you imagine this would affect mental health? What about rates of suicide? Just take a second and think about it. It was bad for suicide. A study of 815 Katrina survivors found the rate of suicidal ideation increased from 3 to over 6%, and suicidal planning increased 2.5-fold. The rates of serious mental illness increased as well. Lest you think the impact falls only on our patients, I'll reference a 2013 study covering the mental health sequela of the 2004 Florida hurricanes on Florida public health workers. The 2004 Florida hurricane season was unprecedented in its brutality. Within 7 weeks, 4 hurricanes and 1 tropical storm made landfall in Florida, causing $5 billion in damage. State and local public health workers played a critical role as first responders in this and other disasters. These workers were found to experience higher rates of depression and PTSD. Workers who had experienced the most hurricanes were 3.5 times more likely to report increased tobacco use and 3 times more likely to report increased alcohol use. Of note, PTSD and depression increases were not attributed to increased workload, which was controlled for. Of course, tropical storms aren't just something that happens other places. You may remember 2015's Typhoon Nul, which struck Yap and other states, dumping 30 centimeters of rain and gusting at over 200 kilometers an hour. That same year, Typhoon Mayask became the most powerful pre-April tropical cyclone on record in the northwestern Pacific Ocean, becoming a Category 5 super typhoon and striking Chuuk, Faiz, Ulithi, and Yap. The storm had unusual staying power and became the first typhoon to pass over Chuuk Lagoon since Typhoon Amy in the 1970s. Factors including the melting of glaciers and expansion of seawater as it warms are projected to cause rises in ocean level between 11 and 47 inches by 2100. Countries with low-lying areas and the majority of islands face grave danger. The island nation of Vanuatu, Tuvalu, Fiji, Kiribati, the Marshall Islands in particular, face total obliteration in the immediate term, despite particularly small contributions to emissions. Vanuatu, for instance, was responsible for 0.0001% of global emissions in 2018, but I had to expand their slice 1,000% so you could see it on a standard computer monitor. Despite these minuscule contributions, they face total obliteration. Hundreds of island communities, as well as significantly larger populations in Southeast Asia and other low-lying areas, face mass migrations and total disruption of their way of life. Take a look around this map. Who do you know that lives here? Where does your family live? Where do your relatives live? The darkest areas represent the greatest threat to tens of millions. And if we expand this to 5 meters of sea level rise, like a flagpole in height, this would impact hundreds of millions of people. For reference, based on the National Oceanic and Atmospheric Administration data, a 2 meter sea level rise today, impacting my current location in Honolulu, would look like this. 3 meters look like this. My apartment, underwater. My hospital, underwater. My clinic, underwater. The best data here on sea level rise is really from the incredible work of NOAA in the United States, but I'll later show more data directly relating to places like Micronesia. As you can see, a 3 meter change in sea level rise can fundamentally redefine a coastline, with low-lying areas such as Oahu's Kailua disproportionately affected. A 3 meter sea level rise would destroy Kailua in its entirety. This is likely a resonant topic for many people of the Federated States, as some islands, including Nalepenlod, have already been lost to sea level rise. The Northwest and Southwest Pacific Ocean continue to face the fastest global sea level rise in the past few decades. Sea level rise in this part of the world has typically been 2 to 3 times the rate of the global average. In parts of Micronesia, sea level rise between 1993 and 2012 rose at 3 times the global average, and the island of Laip has shrunk significantly since 2007 and may disappear in the immediate future. Reef islands, with their loose packed gravel and sand, are particularly vulnerable to wave erosion, which hastens their disappearance. In many places, such as the Dawak Islands, the erosions leave behind skeletonized mangrove tree roots where the sand has washed away. Sea level rise, along with changes in rainfall patterns and glacier melt, are associated with increased frequency of flooding. Based on today's population distributions, a meter of average sea level rise could expose 150 million people to potential inundation, rising to over 500 million with 5 meters of sea level rise. Like other disasters, studies show more floods mean more trauma. For instance, take a look. 6 months after the 1999 Mexican floods, a study of over 500 people found 1/4 had developed PTSD. In the years following the 1990s flood in Hunan province, China, we saw increased symptoms of trauma. But that same year, flooding in Bangladesh brought 3/4 of that country underwater, including the capital city, Dhaka City, displacing 30 million people and bringing about a rise in reports of domestic violence. A 10-year satellite-based analysis has shown for the first time that biological productivity in the oceans is tightly linked to climate change and would be reduced by global warming. This satellite data, gathered by NASA and published in the journal Nature, details the ebb and flow of microscopic life within our planet's oceans. Here, robust plant growth is represented in green in areas of low productivity in blue. Phytoplankton, which are responsible for most of the transfer of carbon dioxide from the atmosphere to the ocean, also contribute the oxygen of half of every breath you take. Phytoplankton's role in the carbon, nitrogen, and phosphorus cycle cement their crucial role in stabilizing global food chains. Here we can see a forecast showing low, blue, to high, red, nitrogen to phosphorus ratio in oceanic algae. This crucial ratio will be irreparably disrupted given even a 5 degrees Celsius temperature rise. Rising temperatures and changes that bring are harming fish stocks in most parts of the globe. As of 2020, 38 million people worldwide rely on fishing as their main source of income or sustenance. That's a California's worth of people. Disruption of the oceans places tens of millions at risk for loss of work, places entire regions at risk for food scarcity or famine, and threatens the very air we breathe. Deforestation describes the tremendous loss of biomass, largely due to human-directed activity, stuff like farming, land clearing, supportive grazing, and mining. 80% of our planet's land-based species live in forests, but the area of native tree forest worldwide has decreased by 700,000 square kilometers since 1990. That's an area 50% larger than France. This is according to the Food and Agricultural Division of the United Nations. Most agree there has been a loss of countless important locations of world heritage. In general, surveys reveal most people believe forests are a source of health and protection versus stress. Unwanted changes to one's environment are often linked with dysphoric feelings of grief, which Glenn Albright termed as solastalgia. Derived from nostalgia, solastalgia is a special kind of homesickness we get when we're at home, but our home is no longer the same. Component to the phrase Anthropocene is an understanding that humans have now become the dominant force shaping evolution and extinction events on our planet. At five other points in Earth's history, there's been a significant event of mass dying. Now, to quote biologist Telmo Piovani, the asteroid bears our name. Although this represents just a blink of an eye on a geologic timescale, human dominance across the last 12 millennia has produced an estimated extinction of one species every 20 minutes. As Martin J. Reeves wrote, we are destroying the book of life before reading it. Growing visibility of these animal extinctions contributes to the phenomena of eco-anxiety, which we'll detail more fully later. Micronesia itself has experienced loss of bird species, and many other species are threatened, such as the truk monarch, the yap cicada bird, and the truk white-eye, with many other species threatened, such as skinks and flying foxes. A decade ago, most of the world's nations committed to limiting warming to well below 2 degrees Celsius. In the years since, we've seen continued temperature rise and documented the 5 hottest years ever. Here again, we see these least responsible for temperature rise disproportionately affected. Over the last 20 years, the number of additional heat wave days has risen substantially and brought with it a 50% increase in heat-related deaths. Heat stress, directly caused by things like heat waves, has been associated with mood disorders, anxiety, and similar problems. The impacts of rising heat are widespread, but again, they're disproportionate. Take, for instance, the percentage of deaths, which was higher in women than in men during the recent European heat wave. We also see particular vulnerability in the mentally ill, who face heat with reduced resources, or children who have incompletely developed temperature regulation systems. During pregnancy, especially in the second and third trimesters, exposure to heat waves has been shown to lower average birth weight and increase preterm birth. In hot temperatures, increases in discomfort lead to increased feelings of hostility, aggressive thoughts, and possibly actions. Hotter cities are on average more violent than cooler cities already, but if you zoom in on any given city, we see local increases in violent behavior in the hotter months. More heat will exacerbate these trends. 2019 was the hottest year ever recorded on my island. 2019 featured the hottest day ever recorded in Honolulu's history. And the last 5 years have seen peak average annual temperatures across all Hawaiian islands. The Hawaiian temperatures are increasing by a third of a degree every decade, 4 times the rate of increase from a half century ago. In Hawaii, average temperatures could increase by as much as 5 to 7.5 degrees Fahrenheit by the end of the century. Because of heat and other factors, Hawaii has lost 1.5 million acres of native forests. These forests are natural water and climate regulators, without which we see disruptions in typical weather patterns. Warmer water holds less oxygen, harming coral and helpful algae, depriving turtles and fish of important food sources. Species of human and animal viruses are following rising temperatures to new areas, and hotter summers give these invasive species a foothold. As warm, loving grassland replaces native species in places like Kauai and Maui, risk for wildfire grows, and we pay the price. It's likely that mental health medicines are among the most likely contributors to heat-related injury and death. A classic European study of inpatient heat admissions found anticholinergic drugs, antipsychotics, and anxiolytics more likely in hospitalized people than any other class of mental health medications. And definitely don't like memorize this list, but it's worth noting that many classes of mental health medicine cause changes to how the body responds to heat. For example, SSRIs and SNRIs can cause or impair sweating and sometimes cause fever. Tricyclics impact cardiac output and blood pressure, as do stimulants, which will be involved in both supporting the vasodilatory response during heat and vasoconstriction in the cold. There are numerous other ways that medications we prescribe may interact with temperature regulation and worsen heat outcomes. Happy to talk more about any of these in the comments. The mental health sequelae or consequences of climate change are, again, unevenly distributed among lines loosely approximating socioeconomic status. Black, Indigenous, and people of color are disproportionately likely to live in areas impacted by climate change and face these risks with reduced resources to facilitate fleeing or adapting their land. Climate change also disproportionately affects rural areas through difficulties in farming and increased need for forced migration. Loss of career may lead to loss of personal or professional identity, loss of support structures, and a reduced sense of control over one's life. The American Psychological Association associates these factors with risks of feeling for hopelessness, fear, and fatalism. Children are more impacted by disasters and more likely to develop PTSD after a disaster. Reasons behind this include disruptions in routine, separation from caregivers, and the stress of primary or temporary caregivers, which often falls heavily on children. The more we discuss climate change with young people, the more we come to understand their growing worries about its many harmful impacts. While some report grief, despair, guilt, shame, powerlessness, sadness, or anger in response to climate change, reports of anxiety are the most common emotional response reported worldwide. This so-called climate-related anxiety, which describes the feeling of concern regarding the present or future of our planet, has also become a source of debate in the media and culture. Many times this debate mistakenly conflates anxiety, the tension and worried thoughts, and anxiety disorders, a group of mental health problems which involve a pattern of excess anxiety that interferes with normal functioning. Let's talk about the words we use to describe climate-related anxiety. The above changes to our planet bring about substantial anxiety in many ways across a variety of timelines. We observe increases in anxiety for those exposed to such disasters, but also those who read about them and who anticipate future eco-catastrophe. In an acute sense, extreme events bring extreme trauma, especially to the underdefended and helpless. Subacute impacts appear for individuals who directly witness climate change and experience anxiety related to the uncertainty of long-term survival of humans. Feelings of political gridlock or inaction or downright political sabotage can exacerbate this anxiety following emergencies. The severity and degree of exposure to climate disruption appears to impact outcome, as does the degree of damage, the time course, and the inability to collect possessions. It's also more harmful the greater the perception of the threat of future losses. Chronic anxieties result from large-scale social and community disruption through violence and struggle for diminishing resources, which we're already seeing in many places of the world, as well as displacement or forced migration, which we're already seeing in many places in our world, and chronic environmental stressors. Popular media like TV, movies, books, social media are now inundated with stories of the looming climate crisis. So much so that in 2019, Grist magazine called climate anxiety the quote, biggest pop culture trend of 2019. Analysis by The Lancet found that from 2018 to 2019, the coverage of health and climate change in the media has risen by almost 100% around the world. Fears ranging from loss of familiar environments, mass deaths of beloved animal species, and increasingly frequent disasters are now widespread. This is critical to recognize and to understand. The mental health implications of climate change have potentially spread to anyone within reach of communications technology, nearly 100% of the people on Earth. So that's like a mega bummer, right? What are we going to do about it? The solutions, to the extent they exist, combine professional advocacy and personal lifestyle change. So let's talk about both. In terms of personal lifestyle change, you can follow the usual advice. Reduce your use of single-use packaging, have fewer kids, reduce meat in your diet, shop local, and of course, recycling. We can also work to understand, calculate, and reduce our carbon footprint. The average American is responsible for the release of 15 metric tons of carbon dioxide every year. You, average American, release 3 elephants of pollution into the air every year. The distance we travel by car, bus, train, and plane, the energy we use in our home, the amount we spend shopping, and the composition of our diet can have significant implications on contributions towards the global climate crisis. Purchasing carbon offsets is one critical way to support our natural and human-led projects, which work to sequester carbon from the atmosphere. Projects ranging from natural grasslands, bird sanctuaries, and old-growth rainforests can be supported relatively cheaply and work to directly combat the main driver of the climate crisis. Websites offered by not-for-profit entities like the Cool Effect offer easy-to-navigate marketplaces for carbon offset purchases. We can also be sure to educate our patients about protecting themselves from rising temperatures. Here's some quick tips from a pamphlet I designed for Mass Gen Hospital. When it's hot, remind your patients to stay hydrated, stay cool, stay safe. Teach them the signs of heat exhaustion and that it may progress to heat stroke, a medical emergency. There's a new website made in collaboration between the Center for Disease Control, National Oceanic Atmospheric Administration, the Environmental Protection Agency, FEMA, the Office, OSHA, HHS, the Forest Park Service, the VA, the Substance Abuse and Mental Health Services, and other governmental agencies while they still stand. Heat.gov provides a great deal of data about current heat conditions and webinars, programs, and other materials for heat safety. Among the resources Heat.gov provides is a page for healthcare professionals that prominently includes the Coping with Heat resource sheets prepared by my frequent collaborator, Robin Cooper, MD, president of the Climate Psychiatry Alliance. In terms of professional lifestyle change, the members of professional organizations like the American Psychiatric Association can advocate to reduce our greenhouse gas emissions. After all, the healthcare sector is responsible for almost 5% of global greenhouse gas pollution in 2017. If global healthcare industry were its own country, we would reportedly rank seventh among all countries in terms of pollution. Are we okay with that? There's 200 countries. Are we okay with that? The American healthcare industry is responsible for roughly 8% of American greenhouse gas emissions, directly contributing to over 100,000 disability adjusted life years lost annually. Are we okay with that? As you can see here, healthcare access and quality measures can be increased without necessarily increasing emissions per capita. The United States healthcare system is uniquely awful in terms of unnecessary emissions, leaving us plenty of room to reduce our pollution. We observe countries in Europe with equivalent or higher healthcare access without significant emissions increases. A roadmap for such changes can be found in England's National Health Service, the largest employer in Europe, the largest single-payer healthcare system on Earth. While continuing to provide high-quality services for up to 60 million people, the Sustainable Development Unit was founded in 2008 to ensure the health service met its commitments under the UK Climate Change Act. Significant reduction in carbon footprint followed, and in January 2020, the NHS England announced its commitment to become the world's first net zero health system. Similar efforts worldwide have led to increasing spending to adapt health systems for the climate crisis, up 5% year on year. Under the Biden administration, the United States works to follow in this footprint. but it required individual and professional advocacy. That will not happen now without a significant push. Across the nation, individual health professionals and their organization have followed the NHS model, with health institutions committing to divest over $40 billion worth of assets away from fossil fuels. The American Psychiatric Association can, with encouragement, join in this worthwhile trend. Says The Lancet, it is essential that the solution to one economic and public health crisis does not exacerbate another. And in the long term, the response to COVID-19 and climate change will be most successful when they are closely aligned. As global governments leverage unprecedented policies to protect populations and health systems from the worst effect of COVID-19, of bird flu, of resurgent smallpox, we have a unique opportunity to advocate for policies which balance economic recovery with climate resilience. According to the American Psychological Association, the key to combating the negative psychological and mental health consequences of climate change is to focus on building resilience among individuals and communities. One strategy for this is to encourage professionally and through public policy increased social connections. Analysis of climate change related media demonstrates that exposure to climate catastrophe promotes anxiety, with worse stress associated with alarmist and as scientists, we have a responsibility to promote evidence-based messaging about this crisis and emphasize the actions we can still take to reduce the impact. In academia, there's been a ninefold increase in publication of scientific articles on health and climate change since 2007. Organizations such as Good Grief offer community and public health programming to build resilience against climate catastrophe. Their system is a 10-step program incorporating heavy emotion processing, deconstructing cultural narratives, and building resilient communities. For younger people, there's other valuable tools, such as NASA's Climate Kids, while it still stands, or the Alliance for Climate Education for Adolescents. In conversation with children and adolescents, begin by finding out what they already know. Then explain the science in simple, age-appropriate terms. Don't sugarcoat things, but emphasize that there is still hope and that there are actions which we can take to help. Working to advocate for clean air regulations or responsible carbon emissions can work to benefit our patients tremendously. It's worth mentioning Micronesia has been an international leader in efforts to ban use of hydrofluorocarbons, HFCs, the world's fastest growing greenhouse gas. This advocacy should be celebrated, as HFCs are 4,000 times more effective at warming the planet than carbon dioxide. We can also work to advocate additional resources for those we recognize to be statistically at greatest risk. Easy to access initiatives on social media, such as Doctors in Politics or the climate-based Sunrise Movement, greatly reduce barriers to entry. The US government has created the Ready.gov program to assist physicians and families preparing disaster resilience strategies. We'll briefly take a look at their recommendations here as we're about to wrap up, and as well as those of the American Psychiatric Association's Climate Change and Mental Health Caucus. Following, discuss the following with your patients. Emergency alerts, shelter plan. What's their evacuation route? Do they have a family or household communication plan? Do they have an emergency preparedness kit? And have they stored appropriate emergency supplies for everyone 2 years and older? The SAMHSA Disaster Technical Assistance Center prepares providers to deliver an effective mental health and substance abuse response to disasters. They have easy to access resources and support, including a phone number, email, and even an app. As I've laid out, the crisis of climate change facing the world today is substantial. With billions already impacted and the worst impacts yet to be felt, the mental health stakes for our patients, communities, and beyond are greater than any challenge yet faced by mental health and public health professionals. We now stand as a profession uniquely qualified to recognize and combat the trauma, mood, and substance use disorders and overall disruption of life we know are increasingly impacting billions worldwide. The stakes are high, and there's everything to play for. So let's get to it. Thank you.
I have the feeling that wasn't the first time you ever gave that presentation, huh?
I won't shut
It
up
was,
about climate change.
yeah, it was wonderful. Um, okay, first question is, do we have a flyer like that for Hawaii?
Maybe I could take more specificity on a flyer like which part?
Oh, in the presentation, you showed some flyers from different places.
Mm.
Let's see, um, brochure.
Yeah, the yeah,
Yeah,
from Mass
brochure.
Gen. Yeah, that's broadly helpful and very appropriate in the Hawaii context. There are some additional resources that are maybe worth thinking about. There's a great resource. I'll try to track it down here in just a second. But there's a great resource on dehydration, which compares urine appearance, a key marker of dehydration, to popular Polynesian and Hawaiian beverages. A shave ice and some tea and others that I find is a helpful, relevant local resource. But in general, I'd say the resources we use nationwide can broadly be applicable in terms of reducing things like heat exposure and illness.
Another question is, where are the carbon emissions? Oops, sorry, it jumped. Where are the carbon emissions coming from in the US healthcare system? Is it our packaging? Is it our burning things? I mean, I'm sure there's a lot.
For those of you who have a deep interest in this, I have co-authored along with two other APA psychiatrists a technical paper, a white paper on decarbonization with a focus on the mental health industry that I think speaks to these broader trends. I would be happy to share this. I don't know the exact mechanism for sharing things from VH Echoes, but in short, the greatest sources come from keeping the lights on at facilities, the tremendous amount of plastic waste even going back early into the manufacturing process for pharmaceuticals, shipping is a huge part of this. But if we look at things that we could imagine maybe doing less of, we could imagine things like transitioning some of our in-person clinical encounters to telehealth, which calculations show uses about 99.5% less energy than meeting in person with people traveling to the facility. Other things such as I love the American Psychiatric Association, but when we host our annual meeting, the pollution from meetings such as this are nearly unfathomable. For those who want to try, imagine you're at a railroad. You see a train car with 22 boxcars brimming with coal. If you burned all of that, that is one medical association annual meeting. That is an unfathomable, to use it again, amount of pollution. One person traveling to a medical association annual meeting on the mainland uses more carbon dioxide in that singular action than the United Nations recommends a person take in a year. That's why I focused my advocacy on working to reform how annual meetings occur. That's probably the single largest opportunity that mental health providers have at making a noticeable difference. Really quick on how to achieve that. Alternating annual meetings to be virtual and in person, instant 50% reduction in carbon footprint from that. If you move your annual meetings to be in locations closer to your average meetings, you get meetings which are about a third less polluting. You get into some like equity issues because the closest place for every American Medical Association is like New York, Philadelphia. And you really get into some like that could not be further away from most of the people listening on this call. So there's some justice issues in there that are important to sort out. But reform to annual meetings, probably the largest, change to the share of visits that occur as telehealth versus in person are probably our two largest opportunities for impact.